If you work with cash pay patients and you're wondering, how do I keep them healthy, happy, and on my schedule? That's what I'm going to be covering inside this video. My name is Dr. Garcia. I help cash-based physical therapists just like yourself improve clinical outcomes and patient satisfaction. When we look at why people stay on your schedule, you have to wonder, what is it? Is it your clinical skill? Is it your personality? Is it your clinic colors? Is it that you're right around the corner? There's a lot of factors on why patients stay loyal to you. You have to figure out why they came to you in the first place. And if you're working with cash pay patients, it wasn't just your clinical skill, because clinicians who work in insurance-based settings that are doing fantastic. However, they might lack the resources to create an incredible experience and service for that patient. Now, the patient might choose you because they also have a great process. It's so seamless. It's online scheduling. It makes it low barrier or friction to come in and see you. There's multiple things. But the most important thing that why people stay loyal is that you understand them. Regardless of the friction that you provide, maybe you don't have online scheduling. You have to go through 5 different receptionists to get onto your schedule, or you have to fill out paperwork every single time. People are willing to do these things if they provide value. Now, they only provide value if you understand the customer's wants and their needs. That is truly what it comes down to. So let me give you an example. Somebody has shoulder pain and they love playing pickleball, and that person can't play, and they love playing with their spouse or their son or their daughter, and that's their quality time with them. That is the most important thing in their life at that time. Now, if they come to see an insurance-based provider who doesn't understand them, they say, oh, I'm an expert at shoulder care. I can deliver on exactly what you need. And they say, great, I'm trying to play pickleball. We're not talking about pickleball, sir or ma'am. We're talking about your rotator cuff. It's a rotator cuff strain, and you're gonna have to do these exercises. We don't know exactly how long it's gonna take, but I'm the master clinician, and we'll just come back every single time, and I'll help you get better. Versus somebody who then takes a different approach and said, okay, great. How fast do you want to get back to pickleball? As soon as possible. I see. Have you had problems like this in the past? No. Have you been to other physical therapists? Yes. Great. What didn't you like about them that you came over and saw me? Well, because they rushed through the entire session. Okay, I definitely won't do that. But what else didn't you like? Well, they didn't even ask about my form or my mechanics. That's fantastic. We will cover that as well. What else didn't you like about them? Well, they gave me too many exercises. Wow, we definitely won't do that. Well, they expected me to come twice a week because they thought that I needed to do all those things. Well, the great part is we'll work with your schedule. All of those things allow you to understand that the customer doesn't want to be rushed. They want the convenience of being able to schedule once a week if they can. They want the convenience of maybe the location. They want to be heard. And ultimately, it's your job as a physical therapist to understand what they want and then deliver what they need. Now, that is what brings patients to drive to you from an hour away, 15 minutes away. Convenience is outweighed by value. And value is if you understand the customer and their wants and needs. It has nothing to do with your clinical skill. Your clinical skill is the cherry on top, because this is an example that I just provided. If you understood the customer just from that initial evaluation and everything that it didn't like, now you're going to transfer and say, great, that's what we're going to work on. But if you didn't do that, you never even had the chance to get them on the table to work on their shoulder, to assess it. The buy-in and when people make a decision is those first 5 to 10 minutes. And if you don't understand them, they won't trust or, more importantly, value what you're about to provide. No matter how much magic you work on the shoulder, if you don't understand, I really didn't want the manual therapy. I just wanted to know, are my mechanics proper? And are they in the best position to be able to do this for the next 5 years? If they were looking for mechanics, but you're a great manual therapist, your skill is irrelevant at this point because you didn't understand the customer. So why do people stay loyal? Because you understand them. And if you aren't spending the time on creating value by understanding the customer's wants and needs, and you go directly to clinical skill, oh, these are the impairments, it's a winging scapula. Pickleball player says, I don't care, but how does that help me? When instead it could have been, well, great, let's work on your mechanics. And in addition to the mechanics, I'm also going to look at how your shoulder works and moves, so that way those mechanics are maximized. I blended their want with truly what they need, which was scapular mechanics, or whatever it is that you would do. And that allows a patient to understand, wow, that's why I'm going out of network. That's exactly why I'm going cash pay. Notice, I didn't say because you have an hour of treatment. That's not what they want. And it's not because of anything else that you understand and communicate effectively so that that customer understands and gets everything they want out of the session. And that is why patients stay loyal to you. I hope this helps in your clinical approach. As you navigate cash pay patients, you'll see that they're significantly different than insurance-based, purely because the insurance provider or a primary care physician told them how great you were, and they bought into your skills. And that's easy because it's a cheap price. Now that you're cash pay, you really have to understand why a patient chooses to go to you and stays with you. And that's why they stay with you. I hope this helps in your clinical approach, and good luck with your patients. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on treating cash pay patients, becoming that expert in your community, and thriving in business. Thanks, and I'll see you soon.